Yeah, so that's, we'll get into that some. I mean, there's so much to talk about this. That's one thing I was very surprised is there's none. They have very limited knowledge of the effect that training has on the body. And, we'll get into that, but that's, kind of the gist of the issue is we've moved to a completely treatment-based model. And a treatment-based model is impossible to keep us healthy because you have to be sick to be treated, right? And so it's a lot better if we can treat that, prevent the diseases from happening, and that's just not being done. And it is impossible to have a healthy world without this taken seriously.
So, Gary, give us a little bit of background on how you came to be a presenter for exercises in medicine.
All right, so yeah, so again, so my name's Garett Reed. I have a little slide. So I'll get into myself real quick, but I want to start with a quote. So this is kind of like what got me into this industry, and not this part of the fitness world. And so it's a quote. Let me move the chat. It says, the modern civilization is seriously discredited by the ignorance usually to be met with regard to the effects of exercise on bodily functions. If they were more enlightenment on this subject, it is not too much to say that the race would live longer and the average health would be higher. Okay, so think about that. I'll get into who said that and what they're talking about. So a little bit about me. Again, my name's Garett Reed. I have my master's in exercise science, my NSCA-CSCS, my ISSN, CISSN, which is a sports nutrition performance-based cert, my ACSM, EIM, which is what we're talking about today, the American College of Sports Medicine, Exercises Medicine. I've been in the industry for 15 plus years, and I've been a writer for about 5 years. So there's a reason I'm showing you this. Some of my published work is this for like strongman training. Is the log press a viable alternative to the clean and jerk? Here I'm presenting at NSDA Florida conference, the use of strongman in elderly populations and general pop. Let you know about me. So this is me. I'm doing Ironman. When I was in China, I lived in China for a while, and here I'm doing Ireland. Over here, that's me. I'm in Thailand. I'm doing a boot camp out here in beautiful Phuket. Here I am. I was doing a paddling race from the Bahamas to Florida. So that was like a one day, 17-hour paddle straight across the Gulf Strait. It's a wrestling club in China. And then here's me competing in some actual strongman competitions. These are both in Florida. So why am I telling you this? Because I'm not a doctor. We're talking about exercises medicine. I'm not a doctor. I do not have my PhD. I was going to do my PhD in sports, but that fell through. But as we were saying, none of what I've done in my past or I've spoken about in my past, none of that compares to what we're going to talk today. As we were just speaking, no one's heard of this. And it kind of blows my mind. It blew my mind. We might hear pleasantries like make sure you exercise, go to the gym, but it's never given the importance that it deserves. So that's basically why I said, I'm going to do this. I really think it's vital to population of nations, to the globe. I don't think it's possible to be healthy without it. So my goals: bring awareness to the importance of the issue, provide some stats. Again, I don't think many people have seen the actual effect that physical activity does have on our health. I want to provide some basic guidelines. So that's kind of my goal. If anyone is in the world of fitness, this is probably going to be an emerging field. So if that's something you want to look into, I'll provide some resources. There will probably be different opportunities to work within that industry. All right, so what is it? ACSM, you can see it's a global health initiative managed by the American College of Sports Medicine to make physical assessment and promotion a standard in clinical care, connecting health care with evidence-based physical activity resources for people everywhere and of all abilities. and so on. All that means is this is an organization that has recognized the importance of exercise, and they're trying to connect fitness professionals with the medical field. They're also trying to introduce strength and conditioning classes within the medical field, because right now it's non-existent. Here's like the presence. So this is the map of where there's different organizations set up. Canada, USA. Essentially, there's kind of a lot of placements all around, but it's still growing. It's still pretty new. So, however, I was just saying, right now, EIM, they're focused on, they're still kind of focused on the treatment side of things. When someone has high blood pressure or someone has diabetes, using exercise to treat that. But I think we can do better. So that first quote that I said at the beginning. So who said that? That was a man named Eugene Sandow. He was a world-renowned strongman. He created the Institute of Physical Culture and Strength way back in the day. Is there any bodybuilders in here? There's any bodybuilders? You know, the Sandow Trophy. This is the trophy at Mr. Olympia where they hold up the trophy. This is him. This was him sitting up there. He was a strong man, but he was concerned with the muscles and aesthetics and training to improve muscle size and all that. And he became, he's known as the grandfather of bodybuilding. So here's what's interesting though. He was also, in addition to his training, his strongman, his bodybuilding, he was also a physician. He was the professional, he's personal professor of scientific and physical culture to King George of the United Kingdom. And he also, at that time, he had opened up a facility that used exercise to treat people without the use of pharmacology. This is in the early 1900s, 1907. And what he said is that, just to let people in, he said health rather than muscular strength should be the object of physical training. And still more people coming through. Back to what I was speaking about earlier is the health industry, we call it the fitness industry, but the fitness industry, generally when we think of fitness, we think of Gold's Gym and bench press and biceps and six packs and all that stuff. However, I think I call that what I call luxury fitness. That is on the luxury side. None of that's all good, and you can definitely train for that, for athletic, for increasing your sprint time and all that stuff. However, how many times have you heard someone say, I don't want to go to the gym because I don't care how I look. I don't care about six pack. I don't care about my biceps. And in their mind, looks is the only reason you would go to the gym. Looks is the only reason you would go run or train or lose weight and all that stuff. Because while the health industry does need to work on promoting exercise science, the fitness industry needs to bring health back into its primary objectives. As I say, fitness is health. I always say fitness is health. It's the same word, just different people use the word, but it means the same thing. And so that's kind of like what my viewpoint is the health industry needs to work, and also the fitness industry. We need to start promoting health, living longer, longevity. That's the reason you go to the gym. That's the reason you walk every day, all that stuff. So quick history. I don't know, can you speak? I don't know if the chat is the chat on. This movement is not a new movement. If you could guess, like, when do you think is the earliest proof we have of a physician prescribing exercise to treat a condition? Okay. So this doesn't mean someone saying exercise. We're talking about someone who has identified exercise as a medicine to treat a disease. You might think 1900s or 1700s or 1200s. In reality, the very first evidence we have of that was actually in 600 BC in India with a physician by the name of Sarsuta. So that was over 3,000 years ago. Okay, over 3,000 years ago, this doctor, this physician, had already recognized that people who were more physically active were healthier, they had less disease, they lived longer. Of course, he didn't understand the mechanisms. He didn't understand, he has never seen the cell, he's never seen any of that. But he was able to make kind of what I say, like obvious connections. He believed in what called dosas. These are like different energy spirits, energy vibes that went through the body, and they need to be in equilibrium. And to do that, he believed in an active lifestyle, diet, and abstaining from harmful habits. That's basically what we're trying to do today, and it's still not being done. But he had already recognized that 3,000 years ago. And that's kind of the point of this, is we know this is an issue. He had recognized exercise improved mass, strength, endurance, reduced obesity, increased digestion, improved appearances. And what's interesting is we think of diabetes. Diabetes is extremely prevalent, right? And more than 3,000 years ago, he had already put together and connected obesity with diabetes, and he used exercise as treatment, which is, when you think about that, over 3,000 years, he doesn't have CAT scans, he doesn't have DEXA, he doesn't have any of things. And he was able to connect that those who were physically active became obese and developed diabetes, and they quality of life and all that stuff. He had a quote, says, "Diseases fly from the presence of a person habituated to regular physical exercise." This is 6,000 years ago. After him, we go through a quick timeline. I could talk forever on the different physicians and the philosophers who had made these connections. Do you know Pythagoras? You heard the Pythagoras theorem, right? A squared plus B squared equals C squared. What we always hear about that, right? We always hear the Pythagoras theorem, but we don't hear that he was actually a medical physician. He was one of the first physicians in Greece, and he advocated daily exercises for health reasons. And it's funny that we always hear about A squared plus B squared plus C squared. We never hear about his advocacy of exercise to treat diseases. Then we have a man named Herodicus in 500 BC. Again, this is still before AD. This is still 500 BC. We call him, he's trying to know, like the father of sports medicine. Okay, he practiced dietetic medicine. And what made him special is he was an ex-gladiator. And so at that time, gladiators and the physicians, they didn't really talk to each other. They kind of had a little spat. They didn't connect with each other. But because he was an ex-gladiator first, and then a physician, he was able to go back and work with the gladiators, and he started making all these connections again. Then we go a little bit before 6370 BC. Who in here has I heard that you've heard the Hippocratic Oath? That's the oath the doctors take. Ethics, I will do no harm. So he's one of the most popular ancient physicians. Probably his most famous quote is, "Eating alone will not keep a man well. He must also take exercise." So what makes him more special is he was the very first physician to actually give a written prescription. So not only did he promote it, but he actually, a patient would come to him and he'd write out exactly what they knew. He'd write out prescription. He liked playing sports and all that stuff, and he would actually give that prescription. Another guy, I'm not good with his name, Erasistratus, 310, 250. They call him the father of physiology. He prescribed moderate exercise, gymnastic activities, dieting, bathing, and he also believed in limiting medication. Then we have Galen. So Galen is kind of, people consider him, like the father, the grandfather. He had the most influence. And his teachings on exercise and medicine, lasted some 1400 years. He prescribed exercise for weakened patients. He treated those with arthritis, depression, epilepsy, vertigo, gout, all these things. I mean, this was still all 4 AD. So this is all more than 2,500 years ago. So after that, when the church came in, the Christian church, things kind of died down because there was a little bit of a drop. It kind of put more focus on spirituality and praying and all that stuff. But that movement that they started was still taught, it was still practiced all throughout the entire time. In 1553, there's a Spanish physician. He said, if we use exercise under the conditions which we will describe, it deserves a lofty praise as a blessed medicine that must be kept in high esteem. So again, another doctor long before who had recognized that when his patients exercised, that they were better than medicine, they were better than anything that was happening. Again, 1776, William Buchanan, he said exercise alone would prevent many of those diseases which cannot be cured and would remove others where medicine proves ineffectual. So what was going on with him is at that time there was some kind of weird stuff, different elixirs, and people had started getting away from the exercise. And that's what he was saying, that people are starting to use these ineffective exercises and they need to come back. So this is interesting. This is when we start getting more into like really modern day physical activity stuff. So in 1690 and 1731, there's a man by the name Bernardi Ramazzani. He was the first epidemiologist during like the Enlightenment period. So what's interesting is during this time, in modern time, a lot of people try to point to other things, whether it be seed oils, food, chemicals, all these other things. They try to say create all these illnesses and NCDs, and none of that should be ignored. However, back during this time, none of that stuff really existed. All he had to look at was basically people's lives and how that affected their outcomes. And he noticed that there's a distinct difference in the health dependent on the profession of that person. So what that means is he has a quote. He says, let tailors be advised to take physical exercise at any rate on holidays. Let them make the best use they can of some one day, and so to counteract the harm done by many days of sedentary life. So what's he saying? He compared tailors to the messengers. Messengers, they ran on foot. They were very active. He knows that the runners, the messengers, they lived longer. They had less disease. They did get sick. They responded better to therapies. They had better quality of life, less injuries, all that stuff. However, let's say tailors and cobblers, they're in one sedentary room working. They're not moving. They're limited movement. And he saw that they are being affected by it. They're having higher rates of disease, higher rates of illness, lower quality of life, and all that stuff. And so what he did, he said, when you go on holiday, you need to move, right? When you go on holiday, you need to move as much as possible because you're sedentary all the rest of your life. Right? You need to move. And we're going to start seeing this kind of same observations throughout for the rest of the, up until modern times. And there's still a percentage of people that kind of refuse that this is like a real thing. They refuse to acknowledge its importance. They refuse to treat it and change it. So there's a few other guys. Again, I could go all day speaking about these men. Francis Fuller. What all this says, this big, long treating, is basically, everyone's coming in. Okay. What he is saying is, to sum it up in one sense, people have acknowledged the power of exercise, yet they ignore it. Okay? Just like we do today. Okay, when he says right here, yet at the bottom, look upon it as a forlorn method. Basically, that means they had started looking at exercise like they didn't want to do it. He says, thus, a negligent diffidence, they deceive themselves and let slip the golden opportunities of recovering by a diligent struggle what could not be procured by the use of medicine alone. So all he's saying is, he's basically warning people that they need to stop looking for elixirs. They need to stop looking at bloodletting with the slugs. They need to stop doing these things. Well, they can keep doing it, but they need to start exercising again. And again, this was back in 1700, and that's basically what he's saying. And it's funny because this is basically the same issue we have today. There's a lot of people who, they know that exercise is good for them, yet they don't do it. So again, 1806. So 1750, what happened in 1750, right? The Industrial Revolution. If you could guess. So all these different individuals, physicians, they are noticing that sedentary jobs are resulting in an increase in disease, illness. Do you think the Industrial Revolution helped that or made it worse? It probably made it worse, right? Obviously, the Industrial Revolution was very good for. Obviously, the Industrial Revolution was amazing for economics and the growth of society and all this stuff. But what that meant was there were more factory jobs. Things became easier. Eventually, you'll have the rise of the car. And all that mitigates our need to move, right? So I always joke my friends, we're now, now they're trying to make self-driving cars. It's like, how much more comfortable do we need to be, right? Because in a real way, comfortability is it's one of the main causes of our physical activity, which is one of the reasons we are so sick. And we keep trying to make things simple and as relaxing as possible. And that's not always a good thing. If you have an industry that makes life easier and limits the work, that's great. If you use that extra free time to go hiking, to go swimming, to do a sport, to do whatever it is you do, right? But what happens in generally worldwide is people sit down, they watch Netflix, they play on their phone, and eventually that's going to have a major effect on what was already a problem and dramatically increase it. So again, a couple more quotes. 1843, man in King's College, he contrasts mortality rates from sedentary and physically active workers. Which one do you think had better health? The physically active. Another man, 1863. So this is interesting, Edward Smith. He compared his findings to the findings of this man, right? 160 years earlier. And he found that the tailors in London were still had sicker and lower quality lives than the more physically active tradesmen in the city. So again, this is another observation that there's this very obvious trend that this sedentary life, this easy life has a obvious influence on the health of the individuals. So, so now we're at a point in history, and this is all important because this kind of brings us to where we are today. Something happened in the 19th and 20th century. So one, obviously we had the revolution in the Industrial Revolution in America. So that started picking up. But there's another major difference that occurred. So before this, I didn't really go over this much. Before it now, many of the physicians in the medical field, they still acknowledged, the use of exercise for preventive medicine, right? They had some medicines and stuff to treat, but it was more of a 50-50, right? In the very back in the day, it was, was the predominant was preventive health, right? And that slowly started to change. And then in the 20th century, 19th, 20th century, what happened? scientific innovations, mainly antibiotics, vaccines, surgical techniques. All of these things, what they did is they almost virtually eradicated infectious diseases. And at the time, infectious disease were the primary killers of the population. Hospitals became centers of care. Healthcare systems were primarily designed to address acute illnesses and injuries. And so this is where things really start shifting in the medical field. Before, what was a treatment-based model, or more of a treatment-based model, it started to change into a what started as a prevention-based model started to transition into a treatment-based model, right? And we're going to see the effects of that. But what happened is they increased vaccines and all that worked, okay? So these are the crude death rates for it. So this is in the United States. But again, around the world, it may happen at different times, but it's more or less pretty similar. So this is 1900, 1920s. That was the influenza pandemic. And then this is when all the vaccines and stuff began to become invented, discovered. Here's penicillin. And look at that. Infectious diseases dropped, right? And it's more or less, we have our outbreaks, recently, HIV, just last, few years, obviously we had COVID. So we do have these kind of spikes, but things like measles, all that stuff were more or less eradicated. However, what that had an effect on with the Industrial Revolution, kind of making life easier, taking away our need to walk around and work, that was then paired with this more treatment-based model rather than prevention health. And so people keep coming in. And some of these changes, again, they're major labor-saving technological change of the 20th century, the industrial processing of food, culture of consumption, rise of the automobile-based way of life, radio and television, IT revolution, all these things began to have a really massive impact. So we don't really go into this to it, but again, it's these same things start to be seen again, they started seeing increasing diseases of, before it was infectious diseases, now these more degenerative diseases, especially in like the kidneys and the hearts and the blood vessels. So not only did the health model start to change, our diseases started to change. What first was infectious diseases are now these more chronic degenerative diseases. Change in sedentary behavior, urbanization and car use. There's actually a big study, even today in modern times, there's still an association between the amount someone uses their car and their obesity and their level of health. So it started way back in 1940s, 50s, but it's just been growing. It still exists today. So again, increased screen time, TVs, phones. I was a 90s kid. I was born in the 90s. So I grew up, I didn't have a phone. We didn't really watch a lot of TV and we were always running around. It's not like that anymore. Everyone has a phone. Everyone's on TV, playing games, playing computer games. And obviously there's been more studies done and like, yeah, this screen time, the sedentary behavior is having a negative effect on people's health. And so this is interesting. So these are the BMI indexes of American men. And so what this is showing us is a lot of times when we talk about obesity and physical, people sometimes make it sound like it was this is a new thing, like it's something that just happened to us, right? Usually you'll hear like 1960s or 1970s, but that's really not true. This rise in inactivity and obesity started way back here in 1920. So these are the BMI rates values of 18-year-old men on, according to their birth year cohorts. So from 1870 to 1909, the average BMI was, it was about 21 or so. This is an 18-year-old man. 1850, it was even lower than that, right? 19.8, something like that. Then wow, a massive jump from here. Right here, it jumps up to about 23. And then you have 23, assuming not 23, about 22.5, 22.5, and then another big jump in the 1980s. So, point being, is this obviously things like the fast food industry and all that stuff did have a massive effect, but this was a growing trend way before any of that. And again, it comes back to that lack of physical activity, which for whatever reason, people still don't kind of talk a lot about. And so this is when things start getting really bad. So this trend continued. Okay. And, we could go through more quotes and all that stuff, but it's literally the same thing until what we have now. And this is now, we have really seen the dramatic alterations, not just from our health model, but just in the way we're dying. So in today, non-communicable diseases, we call like NCDs. So these are things like cardiovascular, cancer, diabetes. These account for 3/4 of all deaths. Back in 1920, 19, they weren't really much of a thing. They were on the board, but they really weren't, they weren't that dramatic. They were about like I forget the number, about 15% now. Now they account for 3/4 of all deaths. Again, why is that? Because we had created this sedentary lifestyle through urbanization. People aren't moving, people aren't walking around. At the same time, our health model isn't stopped worrying about this prevention, and they started worrying only about treatment. And I talked to my friends, like, the medical field did wonders, right? They eradicated diseases and all that stuff. Well, how can we rely on a health field to keep us healthy if they only treat us if we're sick? Right? It's like this circular reason. If the only way the medical field can treat me if I'm sick, then they really have nothing to offer me to keep me healthy. And that's kind of like the major issue we're going now. Not only is it causing of deaths, but 80% of all premature deaths. These are just some graphs I think we all kind of know that this is a major issue. What's kind of crazy, this is 1990 to 2019. Not that long. We're on this very big trend, just upward trend, and it's getting worse and worse and worse. So this from 1990 to 2019. And not that long ago, right? 2009, it's what, 30 years. Many of us were alive in 1990. Many of us are still alive now. This tells us two things. Like, one, we've known this is an issue, right? Because we were tracking it. And yet very little has been to be done. So back in 1990, the global estimate of loss of life, young life, NCDs were about 43%. So about 43% of like the premature life loss years was attributed to NCDs. In 2019, it's 64%. Right? So from 1990 to 2090, there's a almost 20% jump in the loss of young life from NCDs. And this is in 2019, and it's gotten worse. So there's another issue. Who's heard, a lot of times when we talk about, I think this isn't, when I talk about this, people think I'm criticizing the medical industry. I'm not. The medical industry, like I said, has done wondrous things, whether it's increase of infants, like I said, eradication, especially like surgeries. I saw the other day they had done a transplant, a face transplant. So all that stuff is absolutely amazing. This is more towards that physician stuff, and it's not a criticism. It's just an observation that I think needs to be dealt with. So a lot of times we'll say this is, oh well, we're living longer. Who has heard the claim, well, it's not a claim, it's true that, oh, we're living longer thanks to medicine. That's kind of like a common thing we'll say. Oh, well, we're living longer thanks to medicine. True, we are. There's this thing called compression of morbidity. Basically, it said as life expectancy increases, there'll be a decrease in chronic disease and then an increase in the age of onset. So basically, this means there'll be less chronic disease, and at the same time, people will be diagnosed at a later age, right? So rather than being diagnosed with, say, cancer at 60, it'll be 65 and then 70, right? So not only are we living longer, but we're living with disease less years in a disease state. That's the theory, but it's not true. It doesn't look like that's happening. So there's a big study, mortality, morbidity trends, and this is in 2011, so I'm sure it's worse now. They went and looked at all the data. They said there's substantial evidence that we have done little to date to eliminate or delay disease or the physiological changes that are linked to age. So what that means is the medical industry has done a really good job at treating illnesses, but it's had done virtually nothing at preventing diseases. The incidence of a first heart attack has remained relatively stable from 1960s to 1990s. So that onset hasn't changed. Incidence of some of the most important cancers have been increasing. So cancer we'll get into, it's kind of weird depending on what cancer you're talking about. Obviously, there's been a massive increase in diabetes. The proportion of populations with multiple diseases and number of diseases has drastically increased. Many diseases are mitigated due to pharmaceutical intervention. We'll get to this in a second. Other diseases, it's not that, obviously we've had advancements in pre-screening. And so we've been able to use pre-screening to treat those diseases. However, that still begs the question, it still didn't stop the disease, right? There's a little bit more nuance in that with screening, but you can say, yes, pre-screening has prevented disease from evolving into a major issue, but we were still developed it. Basically, they're saying right now it seems that a lot of our focus is on making people live longer, right? Both my parents died from cancer, and they had both diagnosed about 5 years before their death. And living on I'm sure probably most of you know someone who has died of cancer. It's a very tough life. It's not fun. Uh, they lose loss of function. They get sick, headaches, they can't walk, and it's not a very fun life. However, the doctors acted like it was a success because they lived longer. I was like, that's to claim that someone it's a success because they live longer with a disease is really looking at this in like the wrong perspective. Treating a disease and prolonging their life, it doesn't, obviously it's not a fun life and it doesn't treat the main problem at hand. So right now this is from USA. So right now in US, and this is generally, many of these facts are kind of true worldwide, depending some, obviously some countries are different. But so this is the US. So in the past 30 days, 50% of the American population has taken one drug. 24.7% have taken 3 or more. 13.5% have taken 5 or more prescription drugs. In the past year, 65% have taken a prescription drug. And that begs the question, is like, is that healthy? More than half of our population is on is on medicine to treat illnesses. Can we really consider that healthy? Can we really consider that, living longer? This is an interesting study. So they said, okay, like what happens? And they look at the expected lifespan and morbidity. So this right here is the 20-year-old in 1998 and a 20-year-old in 2006. Right, so these are the expected years. So a 20-year-old in 1998 was expected to live 55 years. A 20-year-old in 2006 was expected to live 56.1 years, right? So you say, oh, the 20-year-old in 2006 is living longer, right? That's good. That's a success, right? However, the 20-year-old in 1998 would live 10 years with a serious disease. The 20-year-old in 2006 would live 12.3 years with a serious disease. So they're living 1.1 year longer, and they're living 2.3 years longer with a serious disease. When we look at limited mobility, the 20-year-old in 1998 will live 3.8 years with limited mobility. The 20-year-old in 2006 will live 5.8 years with limited mobility. Mobility in this is described as not being able to get out of a chair with one hand. So this is very limited mobility. So this is where we're at today. Yeah, we're living longer, but we're getting sick. Also, so this is interesting. So this is the rate of basically overweight and obesity. And this is just from 1960. But what can we see here? The rate of people overweight has been kind of consistent. So this is men. It's even kind of dropped some. And this is women. So again, it's kind of the rate of men and women overweight has kind of stayed the same for the past, what is it, 60 years now? However, what has increased? What has changed? Obesity, right? Right here, about 1976, both men and women obesity rate shot up, right? Same time, severe obesity. It's that same time period right here. This is when really the fast food revolution, this is when really stuff started. Severe obesity really took off too. Again, before 1960, it really wasn't a thing. Severe obesity, this is people with 40 BMI or larger, really wasn't a thing until it was. And now severe obesity is raising off the roof. So this is just another graph so you can kind of see the difference. So the pink is obesity, the blue is severe obesity. And it's wild how much more we've been getting. In 1960, there was about, what is that? Call it 14% obese. Back in 2019, that's pretty much how many people have severe obesity. So these are kind of the stats. 1 in 3 adults are overweight, 2 in 5 have obesity. That's supposed to be 3 out of 5 now, actually. 1 in 11 adults have a severe obesity. Okay, but this is when things like really get concerning, is that 1 in 6 children now, 16.1% are overweight. 1 in 5 children have obesity. So again, this, to be clear, more children and adolescents are obese than they are overweight. Then 1 in 16 children have severe obesity. Again, these are ages 2 to 19. This was not a thing. This used to not be a thing. Then these are some numbers. Again, I think we are pretty much all aware of this. And so now we're going to start looking at some, so as a whole, these diseases are increasing, right? But what's very concerning is really that they had thought that the onset of these diseases would get later on in life, right? That's not what's happening. It's getting younger. Have you seen many of the news articles about men under 50 being diagnosed with more heart attacks and cancer? Now they're making they're suggesting younger and younger populations being screened for different types of cancers. Here we go. So same thing with diabetes. So when I was growing up, juvenile diabetes, like that was type 1 diabetes. When you heard juvenile type 1, we didn't really say type 1 as much. We said juvenile because no juvenile had type 2 diabetes. They had type 1 diabetes. And that's how we that was kind of how it was described. Juvenile diabetes, adult onset diabetes. I'm not sure if any of you were around and remember that. But what happened 3 decades ago? Pediatric type 2 diabetes began to emerge. Today, type 2 diabetes in adolescents is twice that of type 1 in several non-white racial and ethnic groups. So again, this is it's affecting all children, but for some reason it's affecting really affecting. So this is in America, African Americans and American Indians. So you have these population, these are children, these are less than 18 years old, are developing diabetes twice the rate than type 1 diabetes. Another one, we say some people say that cancer is declining. It depends on that cancer, but what's concerning is that we're starting to see this increasing in progressively longer birth cohorts. So 17 of the 34 different cancers, we're seeing them progressively in younger cohorts. I'll go into these graphs in a second. Of these 17, 10 of them are obesity related. Okay. And so again, we'll have some industries try to say there's no connection. There's definitely a connection. In the obesity epidemic in USA has affected individuals across all age groups. Accumulating evidence underscores the substantial influence of body weight in early life, as highlighted by a recent study associating excess body weight during early adulthood, ages 18, 14, 40 years, with up to 18 cancers. So this is a little bit younger, but basically, when a person develops obesity at a younger age, they're at a significantly higher rate of developing cancer, of 18 different cancers. And so these are just the graphs you can see. So again, this is mortality. So we're not dying as much, but the incidence rates are increasing, right? So this is kidney cancer. Mortality is decreasing, incidence is increasing. This is all of them. Again, not good. So this is disturbing. So do you know the difference? So when we talk about physical inactivity and sedentary behavior, do you know the difference? When we talk about physical activity, we're talking about, what we call exercise. We'll get into exactly what that means, but that's exercise. That's running, that's walking briskly, all that stuff. Sedentary behavior, that's things like sitting down, laying down, driving your car, all that stuff. And before, we didn't really recognize that sitting was its own independent factor. And what that means is, let's say I go run 10K in the morning, but then I sit down all day long, right? What that means is I'm still putting myself at a dramatic increase of developing certain diseases. So you have physical activity, which you need to have, but also the sedentary behavior, sitting and lying down, we now know is its own independent factor. So even if you do have your physical activity, simply sitting down, laying down too much can override that sometimes. So there's a study, risk of physical frailty increased 36% for each hour spent in sedentary behavior during daily waking time. So this is like frailty, it's like walking slow, not even be able to get out of a chair, something like that. So every hour you sit down to study, so there's a correlation with a 36% increase in chance of developing frailty. Another study, each 2 hour per day increased an 8% increase in colon cancer and a 10% increase in endometrial cancer risk. And each 2 hours. So even if you're go hit the gym, this is important because in America and many times other countries will have maybe a banker or accountant or so whatever it is, and they're sitting down all day, and then they go to the gym for 30 minutes, hour, whatever, and they think in their head, which is obviously is good, but they will sometimes now think like, oh, I got my physical activity, my sitting down doesn't really matter anymore, which we now know it very, very much does. Prolonged sedentary behavior associated with increased risks of several major diseases and all-cause mortality. So we're now going to get into more of the role that exercise actually does have. So we know now, it's pretty clear that diseases are up, sickness is up, obesity is up, inactivity is up, and all that stuff. So what does that mean for us? Again, when I was saying at the beginning, in our current state, the health industry is not going to keep you healthy. Even if we live longer, we are not healthy. Even if you live longer with disease, we are not healthy. There is this, I'm sure many of you, this is a good example. Have you seen Ozempic used for weight loss? So Ozempic, the big drug that helps people lose weight. However, the vast majority of people using Ozempic regain the majority of their weight within 1 year of cessation of using Ozempic. So what that means is people use Ozempic, when they stop using Ozempic, and they gain all the weight back. Why is that? Because they're giving out Ozempic without giving a prescription of exercise, without promoting exercise. And without that change, none of these drugs are going to have any lasting true effect on us. It's been estimated, and this is another thing that's kind of lost with, and this is thanks to society and other things, that a lot of this health concerns, it's not your fault, it's other things. But we now know that about 50% of our health is determined by behavior. So there's stuff, some people are genetically disposed and all that stuff. However, 50% is kind of up to you, and that's physical inactivity. It's diet, it's smoking, and it's drinking. Those are like kind of the four big ones. There's Rear Admiral said the practice of engaging in regular physical activity is one which must be adopted broadly by individuals and families everywhere if we as a nation are to make truly sustained progress in health promotion. So that's what I was saying in the beginning. The only way we are going to be healthy is if we start engaging in regular physical activity and we start taking it seriously. So ACSM president, he's kind of created EIM. He posed this question that we're always talking about pharmaceuticals and new drugs and all that stuff. Yeah, we have this drug. It's called exercise. He always asks, so if we had a pill that conferred all the proven health benefits of exercise, physicians would widely prescribe it to their patients, and our healthcare system would see it that every patient had access to this wonder drug. But we don't. It's estimated, and this is low, but it's estimated 1 out of every 10 deaths are due to physical inactivity. 1 out of every 10. That means they could be virtually eliminated. So what do we mean by physical inactivity? I think sometimes we hear physical inactivity and people think, I don't want to train for a marathon, or I don't want to be a bodybuilder, or I don't, that's not what this is talking about. So all those kind of things we went through, physical activities, what that's talking about is 150 minutes of moderate intensity aerobic a week. That's it. That's 3 brisk walks during the week, 5 days a week. That's 150. And people aren't doing that. But that's kind of like that official cutoff for physical activity and inactivity. And then also, we always talk about walking and jogging or stuff like that. But also, strength training is also very important too. We're going to get into some of those benefits. But this is what we're talking about again. Okay, this doesn't mean running a 6-day program. Doesn't mean training for a marathon. Doesn't mean training for Olympics. It's this very, very, very minimal effort to get a lot of benefit. Going back to what Robert Ellis was saying, if there's a drug that had so many different benefits, then pharmaceutical companies would be making billions of dollars. So these are just some of the benefits. We're going in a little bit more detail. So this one's in children, even children. Improved bone health, improved cognition and function, improved cardio and muscular fitness, improved bone health, improved cardiovascular, improved weight, fewer symptoms of depression. So adults, all-cause mortality decrease, metabolic conditions, lower mortality, lower incidence of hypertension, lower incidence of type 2 diabetes, cancers, lower incidence of bladder, breast, colon, esophagus, kidney, stomach, lung cancers, and breast cancer, but that's not on here. Brain health. Exercise even improves brain health. Reduce risk of dementia, improve cognition function, improve quality of sleep, improve sleep, anxiety, depression, weight status, all this stuff. And then in health centers, these are elderly patients. Reduce incidence of fall-related injuries, improve physical function, reduce so then breast cancer, reduced risk all cause, and breast cancer mortality, reduced risk of all cause, colon cancer mortality, reduced prostate, decreased pain, improved function, all these things, reduced risk of cardio, obviously diabetes. To really, I would recommend to go check out this study. It's probably one of the best studies out there to show the direct effect that physical activity does have on our health. It's called the Role of Inactivity in Chronic Diseases, Evolutionary Insight and Pathophysiological Mechanisms. And what they found, so this is massive. Oh, there's still people coming in. They found that physical activity is an actual cause. Okay, what this means is it's not small factors, the actual cause of over 35 chronic diseases and conditions. That means there's 35 different diseases and conditions could be mitigated with those bare minimum requirements of physical inactivity. So when looking at everything together, they found that physically inactive groups have increased prevalence of 30 to 50% for major causes of death, including cardiovascular disease, type 2 diabetes, and even things like Alzheimer's disease. Evidence supports the notion that physical inactivity is the actual cause of both shorter health span and earlier mortality. So shorter health span, what that is that's basically those years of disease-free life, right? We'll have men, my dad, I think was 40, he lived just half his life in a disease state, all because of this physical inactivity. So cardiorespiratory fitness disease, these are some actual real studies. Let me see this. So this is just basically let me go back to this one. So again, this is just rates of, so these are the high active, these are just the cross-reference between sedentary behavior and high VO2 max, so it's cardiovascular. Basically, VO2 max, that's how well your body can process oxygen, very short, and that's improved like through respiratory and running and all that stuff right there. And so you can see those with low levels had a significantly higher ratio risk than those with high. And we see that same thing here. People with higher VO2 max, cardiorespiratory fitness, had lower levels of lower risk. And same right here. So these are, again, mortality rates. This is basically different ways to measure those, cardiorespiratory systems. They found that middle and lower quartiles, so these are people who have lower levels of cardiorespiratory health. They're at 2 and 3.48 times the risk of death than those who had better cardio or fitness. Well, resistance training. Again, when I was talking about earlier, so we kind of forget, usually when people talk about exercise, we talk about endurance running or walking and all that stuff. We forget about the resistance training. Resistance training has a ton of benefits that you can get from running. And a lot of times people talk about either or, right? Like, which one should I do? Lift weights or should I go run? So you should do both, right? These are both separate mediums of exercise that deliver different benefits. So there's obviously a compounding effect, but there's some things that lifting can give you that running can't, and there's some things that running can give you that lifting can. Okay, so it's not, this isn't an either or, you should be doing both. Some of the things, resistance training, improvements in cardiovascular risk factors, such as blood pressure, body fat, reduction in insulin resistance, improvement in muscle function, muscle quality, improvement in basal metabolic rate, that's how many calories you burn, reduction of risk of falls, prevention of bone loss, reduction in systematic inflammation, improvement in cognitive function, improvement in quality of life and daily life activities. And so one thing that's really interesting is when we talk about, so and this is big because diabetes is such a massive issue, is that when we talk about diabetes, we always talk about like losing weight, right? You have to lose weight, and obviously that's a major factor. However, what we now know is that low levels of muscle mass also puts you at a greater increase of diabetes. So there's a big study. Less muscle mass was associated with greater diabetes, prevalent independent of body fat distribution in young men. So this is significant, specifically in young men. So young men with low levels of muscle mass had a greater risk of diabetes. Low muscle mass, as defined by MO1, was associated with increased risk of type 2 diabetes, independent of general obesity. So again, what this means is, not even considering obesity, the men who had lower levels of muscle mass had higher rates of diabetes. Why is that? I'm not going to get too deep, but your muscle is what holds glucose, what we call like blood sugar. When blood sugar is going through your body, your blood, insulin is released, and your muscle uptakes that blood sugar, and that keeps your blood sugar levels at a healthy level, right? It's a very, very quick explanation. What happens is when you don't have a lot of muscle mass, your body has nowhere to store that sugar, right? Because your body can't store that sugar anywhere, it's unable to take out of your bloodstream, and that increases elevated blood sugar, which can gradually increase increase diabetes. So again, skill match, reduce fast action, reduce insulin signaling, reduce muscle mass, reduce turnover of muscle triglycerides and glycogen. So again, muscle mass is very important. Muscle strength, okay? The question is like, how strong do you need to be? I don't know. Stronger is better. It's hard to know exactly how strong you need to be. But I think most people would probably meet that strength level after 1 year of proper resistance training. That's completely a guess. But this isn't like massive levels of strength, but multiple studies saw that higher levels of hand grip strength was associated with reduced risk of all-cause mortality. Adults with higher risk of muscular strength had 14% lower risk of death compared with adults with lower muscular strength. All these things, cardiovascular disease, periphery arteries, so these are all things as a decrease by those with more muscle mass. All right. So a lot of times people say, like, oh, I don't know what to do. And at the very bare minimum, everyone should be walking, right? Walking is one of the best things that you can do for your general health. Everyone can do it, obviously, unless you have some sort of disability, but everyone can walk. It's the one thing that like there's not really a good excuse of why you can't. I'm sure people have heard like the 10,000 steps. Watch your 10,000 steps. More is better, but you actually don't need to get 10,000 steps. So there's a study that saw that just 3,000 steps a daily produced a decrease in mortality. Just this 3,000 steps. Optimal steps was 7,000 and 9,000. The greatest steps was those who had that 12 1,500 plus steps daily. So again, that's increasing your physical activity, is decreasing sedentary behavior, all that stuff. What they saw is increasing 1,000 steps a day has a 9% reduction in risk of all-cause mortality. Similar study found that 1,000 steps a day resulted in lower risk of all-cause mortality and health benefits that can even be seen below 10,000 steps. Again, more is always better. But you can start seeing results in 3,000. So if you have someone like, I don't know what to do, walk, right? Always walk. There's no reason not to walk. And that's going to produce some massive benefits. One more 2,000 steps a day saw improvements in cardiovascular complications. Almost 4,000 steps, significant improvements in all-cause mortality. And every 1,000 step increment correlated with significant reduction of 15% all-cause mortality. Every 500 steps had a 7% drop in cardiovascular disease. And this dose response is the more you do, the better results, was seen up to 20,000 steps a day. However, 10,000 steps a day would prevent a lot. Again, this isn't technical. It's not difficult. It's not technical. Anyone can do it. It's free. You need some shoes. It's the freest, most kind of beneficial form of exercise that everyone should be doing. Strength training. So this is in older men. So again, there's this idea that like older people can't train, they can't strength train. They 100% definitely can't strength train. So there was a study, they followed 65-year-olds for 15 years strength training, right? And just 65-year-olds, they trained. Those who strength trained had a 40% lower odds of all-cause mortality than those who did not. And what's crazy is, so this association remained after adjustment for past medical history and health behavior. So what that means is, it's not basically, it means it's not too late to start, right? Maybe you haven't been active your whole life. Start becoming active now, and you can kind of start seeing reversals in the kind of the detriments. Start seeing the reversal in the detriments of your past sedentary life. Again, improved health. I'm not sure if many of you have seen that they're now recognizing exercise and fitness as treatment. And again, this doesn't mean stop taking medications, but in different treatment centers, they're starting to see that exercise is can be a strong addition to treatment plans. And they're not really sure the mechanisms, but somehow there's changes in the underlying neuroplasticity. They say the brain waves change, and it causes a decrease in the increase in wellness. I see this one. Increase in mental health, decrease in suicides, decrease in depression, all these types of things just from exercising. Immunity. This is a big one, immunity. They found that regular, moderate to vigorous physical activity is associated with reduced risk of community-acquired infectious diseases and infectious disease mortality. So this is a huge deal, especially now. Higher level of habitual physical activity has associated 31% risk reduction of community-acquired infectious diseases and a 37% risk reduction of infectious disease mortality. They also saw that physically active people had better results when vaccines were used for whatever reason. When physical activity was given with vaccines, the immune response was significantly better. They had stronger immune systems. Even disease like, say, Parkinson's, there's been effective treatments to even treat Parkinson's. This study had patients with Parkinson's training 2 to 3 times per week over 8 to 10 weeks. Saw a significant result in strength, balance, motor symptom gains. And all this in people with moderate Parkinson's disease. So again, doesn't mean it's going to reverse Parkinson. I mean, it doesn't mean it's going to cure Parkinson's, but it can reverse some of these ill effects that are brought on from the issues from Parkinson's. There's a study just released that what this was is people had been living a sedentary lifestyle up until I think I forget. I think I want to say 50. They've been sedentary up for basically their life. And they'd started to have heart damage because of their behavior. So they started them on a exercise program that included, say, 30-minute workouts with high intensity, some strength training, moderate intensity, basically a whole regime. What they found is that exercising 4 to 5 times a week significantly improved heart function, increasing oxygen uptake by 18% and enhancing heart's elasticity by 25%. So again, these are people who had been sedentary, who had already developed heart damage, and this treatment alone, exercise prevention, exercise protocol, reversed the symptoms. So this is my friend Jeff Young. His wife had multiple sclerosis. And he's all but cured her multiple sclerosis using this. Where'd it go? This training program in multiple sclerosis affects a lot of people. And again, physical training can't necessarily cure it, but it can significantly improve the condition of the patient. And this is the protocol you use. Again, let's look at it. It's not wild. 1 to 2 days a week, progress into 3 to 4. But it is this consistency over reversing the sedentary behavior and training. So here's one. Almost done through all this. There's a lot. So you guess when this was reported. So this is a study that really got me into this too. So I'll read it out. If current trends continue, nearly 50% of the worldwide population is projected to be obese by 2050. This population will have a growing impact on both non-communicable and communicable diseases and may affect global evolutionary trends of influenza virus. That's like what COVID was. With increasing infections in the obese host, so too may the incidence of severe influenza pandemics increase as a result of increased viral shedding and transmission and the emergence of novel viral variants. Curbing the obesity epidemic will not only improve the quality of life for those millions of people directly affected, it will also dampen the impact of obesity on infectious disease. So, big word salad. Basically, what that said is that obesity is playing a major role in the trends of the influenza virus, which is, like I said, what coronavirus is. So you would read this. When I first read it, I thought, oh, this must be talking about COVID, right? That was the big one. But it wasn't. So this was released in 2019. This was taken from research done during the 2009 H1N1 pandemic. Right? So paper was released before COVID happened, but all this information was taken from the 2009 H1N1 pandemic. What that means is they knew that obesity and inactivity are a major contributor to our response to the influenza virus. I had a guy who was like, oh, that's just one disease. So I just made a big, I just found these are just some. So this is what, 9? These are 9 different studies that looked at the association between physical inactivity and the risk of severe COVID-19 outcomes. So you have physical activity associated with a higher risk for severe COVID-19 outcomes. Obesity is a risk factor for COVID-19 severity. When two pandemics meet, why is obesity associated with increased COVID-19 mortality? Severe obesity is an independent risk factor for COVID-19 mortality. Obesity is a risk factor for severe COVID-19 infection. Obesity is a risk factor for developing critical condition. Physical activity and COVID when pandemics collide, a tale of two pandemics. So there's this one again. This is because this one specifically talks about physical inactivity. This was done in Korea. So these are the results. Oh. So these are the results of the rate. So on this side, we have physically active people, and this is physically inactive. So even infection, physically active people were had less chance of being infected, 2.6% to 3.1%. So severe illness. So you do get infected. What's the outcome? Physically active people, 3.5% versus inactive, 0.66. And then death, 0.02%, 0.08%. So what's interesting is obviously the physically active people had a better outcome. But if we look, the more severe the outcome, the bigger the difference is, right? So an infection, not going to be infected, but okay, 2.6, 3.1, what was that? 1 point, what, 50% greater? Not good, but okay. Severe illness, right? That's not very good. Now it jumps about 2 times as worse. And then death, 4 times as worse, right? So the more severe the measurement, the physically inactive people have a much worse outcome. And this is interesting because now there's always stuff on social media, but now there's supposed to be another COVID vaccine coming, and this is proof that we know this is an issue. We know there's hundreds and hundreds and hundreds of articles on this, and yet for whatever reason, nobody says anything. So these are just a few other quotes, again, just to show how much evidence we have that this is a thing. Behavioral causes about 40% of all deaths in the United States. Are encouraged to prescribe physical activity for health as possible. That minimum dose to outweigh benefits. Evidence supports that the conclusion that physical inactivity is one of the most important public health problems of the 21st century. It may even be more important. I think it is. If we had a pill that could, we went through that. If you learned that a single prescription could prevent and treat dozens of diseases, such as diabetes, hypertension, obesity, would you prescribe it to your patients? Obviously, right? The practice of engaging in regular physical activity is one which must be adopted broadly by individuals and families if we as a nation are to make a truly sustained progress in health promotion. So, this is known by health officials and the government, and for some reason it's just still not taken, given the seriousness that needs. And so, what was in with this? This is the World Health Organization, right? So this was printed out in 2019. This is their plan of action. These were all of their outcomes they wanted to see by 2020. So they wanted to see a 25% relative reduction in risk of premature mortality, 10% reduction in harmful use of alcohol, 10% relative reduction in prevalence of insufficient physical activity, 30% reduction in mean population intake of salt sodium, tobacco use, these aren't really prevalent, blood pressure, halt the rise of diabetes and obesity. That obviously didn't happen. So this is the big ones, right? So obviously a halt the rise in diabetes and obesity, that's obviously did not happen at all. That just got way worse. This is the one, a 10%, that's all he wanted. It was a 10% relative reduction in physical inactivity. So do you think that happened? Nope, it did not happen. So these are the levels of inactivity from 2010 to 2022. So again, recent, we were all alive during this period. This isn't way back in the past. This is now. So in 2010, about about 26% of the world population did not meet those basic physical activity levels. So this is a number that was written when that paper was when this was produced. So obviously it did not decrease like they wanted. It jumped to 31% in 2022. And if this current trend continues, which it obviously will, unless something changes, which again, it's happening slowly. There's going to be in 2030, 35% of the world population is going to be inactive. And this is just those basic levels of inactivity. And so what's interesting is they actually even divide this between low income, lower middle, upper middle, and high income. The high income, it actually is kind of working, okay? And the worst is the lower income societies. So lower income societies are becoming more and more and more less active. Again, pretty much everyone is except the high income, but it's most drastically seen in these low income nations. And so this isn't just an issue that Americans or Australia or Africa. It's literally for everyone. Again, these are world numbers. These aren't the UK, because the West is generally known for, especially now, for being inactive or being obese, right? But these are world numbers. So you say, like, so what do we do? So if you're interested in this, I would definitely go check out MR and Muscle Rehab Institute. That was that's this guy, Jeff Young. That's his institute. Or I would go check out exercisesmedicine.org. Again, this is just what I went through today was just like a very crash course on the need. Okay. Again, what the movement is trying to do as a whole is, one, make this more information more accessible, and then two, well, there are really two big ones. They're trying to talk to the medical industry and having the health field start recognizing finally, which it's really kind of crazy they don't recognize physical activity as a measurable health variable. So when you go into a doctor's office and they ask your age and when did you smoke, and basically they want that, but they want to start tracking people's physical activity levels. At the same time, they're trying to put these health professionals to hook them up with various like fitness professionals who are trained specifically in this. And so they're trying to create a system where they can start actually doing prescriptions and all that stuff. However, like as I said, look at that. However, as I said, like it's going to take a lot. It's going to take one, changes from the medical industry. It's going to take one from the fitness industry, and we need to see more. We need to see these type of issues taken more seriously from the health industry, and instead of just promoting six packs and summer bodies, which is great, that's fine. That doesn't mean you need to stop. But these more important benefits need to start being promoted in different programs and how to treat it. And then also as a society as a whole, right? A lot of times people say, oh yeah, you gonna make them work out? It's like, I'm not gonna make them work out, but we were able to reverse smoking. Smoking's a good one, right? Smoking was high, it's causing tons of death, and it took a lot of effort, but they were managed to finally decrease the rate of smoking. This is one example. And so there's a lot of different factors that need to occur, and it's probably not going to happen overnight. But even like you as an individual, one, like I said, I would definitely start walking. If you're not active yet, start walking. I call walking where do I have it? The gateway to healthy lifestyle. And it's like, how many people? I'll say, how many people do you know? Kind of got in this argument, like eating versus exercise, that you need to do both, right? This isn't either or nutrition or exercise. But I was got in an argument with the guy who's saying like, you don't need to exercise to lose weight. All you need to do is eat right, which there's a whole other subject. Yeah, but again, as we saw, physical activity and sedentary is a direct impact on your health, right? It's not either or. You can't just eat right and lose weight and still be healthy. That's one thing we need to kind of realize. That's not a thing. You need to be active, you need to be moving. However, I said, when people become active, everything else kind of falls into place. So I would ask, like, do you know anyone who just eats healthy, but they watch TV all day, they drink, they smoke, right? No. Generally, people now would ask the same way. Do you know anyone who works out all the time and they're very active, but they eat pizza and McDonald's? No, generally these healthy lifestyles kind of merge in together and one breeds another. One interesting thing with exercise is it improves like your executive function. I'm sure probably many of you have probably um have probably trained before, and you kind of naturally just start on their own when it like picking healthier foods, right? I have a lot of clients, I'll train them and they just, I don't even worry about the diet at first, and they naturally start eating healthier foods. They naturally want to start eating healthier foods. And I think one of those reasons is because fitness improves our executive function. Executive function is basically the part of your brain that helps choose like smart decisions, basically make decisions, healthier decisions. And there's this theory that when people, and this is kind of seen many people report this, that they start training and they just start naturally wanting to eat healthier. And so that's why I say just walk. If you don't know what else to do, just start walking. And all these other things will kind of like fall into place. So yeah. Again, this is a lot of kind of information, just kind of really just formatting, like this is a serious issue that needs to take place. I'd like to come back, talk again about more like kind of specific prescriptions, specific training protocols. Again, I've primarily trained in like strongman and strength and conditioning, going over, exercise protocols and all that fun stuff. But this, before we can take that seriously, we need to establish that this is like an issue that we need to address. So again, if you have any questions or want to know more details, I'd definitely go check out these two different websites. Again, if anyone's in that fitness industry on the trainer side, go check out exercisemedicine.org. I maybe I'm being optimistic, but I do think this is going to pick up within that field. And just coming from a pure occupational viewpoint, there could be a lot of openings from that viewpoint in the future. If we get to a point where people do start recognizing exercise for health, I think many people will be looking for a trainer that is specialized in that. So, yep, so that's my that's my that's my what is this saying? I don't know what that is. Okay, so yep, so that's my presentation. I don't know, do you want to do some questions or?
I don't see any questions yet in the chat. Oh, here we come. Lamine has the first question. Lamine, go ahead and activate your microphone and your camera if you can. And we only have maybe 10 more minutes.
All right, thank you very much, Dr. Garrett, for that, great presentation. Today I've learned a lot, about, about health practice, which you normally say, practice is, which you normally say practice is a medicine. When you talking about practice, there are so many things that comes to one's mind. Some people think that it's only running, that one should, try and stick on it, But some suggest that even, fast, fast fast walking, and even riding bicycle, and even going to the gym, which is now frequent for many people now. So what I'm just asking, doctor, is this: which one of these exercise is the best for one to practice? Yeah.
The best. So
Yeah, exactly.
so I don't
yeah.
like. So I don't like really saying the best because I think they're both good. It's hard 'cause I had a discussion before, and I almost think if I could only do one, I would do both, right? There's really definitely do both. I think if I could only do one, I actually think it would be lifting weights. Reason being for that is that lifting weights can increase our cardio health. It can increase our heart and all that stuff. The problem is like running, obviously running does that, riding bikes, but it doesn't increase your muscle mass. It doesn't increase bone density. We didn't talk about that. So you could, if I could only do one, I'd probably do strength training.
Garett, like you were
would,
saying, if you have more muscle mass, you have less of a chance of diabetes.
right. And so if I could, again, I would, if I could tell someone that I only have time, I'd say, lift weights and obviously do walking, right? Lifting weights and walking, I think is the best. But yeah, so lifting weights, I would say if you could only do one, being on a consistent training program, I would say that weight training program.
Yeah.
Or put on some music and dance, right?
Yeah. Sorry. In addition, the reason why I'm asking this question, because I am setting an example for myself, because where I actually live, is about 700 meters, away the highway. So I normally walk very fast. I prefer walking fast than running. Running is not part of my daily routine, so it's not something that I recognize. So this is why I'm asking whether I can keep on engaging on walking fast, whether it's better for my health, or do I need to shift my practice, my exercise to go ahead with running. Maybe I may schedule myself weekly, maybe twice in a week or something like that.
Yeah, so I mean, if you could, I would run. Or you don't have to run. You could run, any high intensity exercise like cycling. So it doesn't necessarily have to be running. I used to be a big runner. I cycle now more. But yeah, so some of the stuff we talk about when we talk about some of those MET values, you will be able to improve your VO2 with more intense running or cycling. So if you are doing one of those and you just don't want to because you don't like it, yeah, I would probably find maybe a different medium to do it. If you can't do it because of some other reason, that's okay. But yeah, I would at least one session. I would do at least one kind of 30-minute kind of harder session a week.
There we go. Okay, thank you, Lamin. We'll go now to Che. Che, go ahead and activate your microphone.
Yes, good afternoon, doctor, and thank you for the wonderful presentation. Hello?
Hello, we can hear you.
All right, thank you very much. My question goes thus. My question is about the impact of exercise on specific health conditions like heart attack, diabetes, and mental health. Yes, so what is the impact of physical activity on these specific health conditions?
On all those decreases.
Garett, if you could focus on mental health, since you've already really talked about diabetes.
Yeah, heart attack and mental health, yeah.
Yeah, so mental health, there's not as much research on there yet. Let me go see the slide. So basically, there's a few different mechanisms.
Yeah, the impact of exercise on specific health conditions like heart attack. and yeah, heart attack and mental health, because I know we have discussed a lot about diabetes already. Yeah.
So heart health obviously definitely decreases, has a significant decrease on heart health. Mental health, so there's a few things. One is regular exercises. So a lot of mental health is from chemical alterations to your body, mind, whatnot. Regular exercise can help mediate those different chemicals. Also exercise, I'm not sure if you've heard like the runner's high, which they now know is like it actually running does increase these chemicals that does give your body like an actual high. And so dopamine, serotonin, all those things flooding your body. And then all the other things, better appearance, better health, given an outlet. There's actually a few different organizations that they almost purely use exercise as their treatment facility. They're very, very successful. Also doing it outside. For some reason, exercising outside and being in the sun and being in the wind and all that stuff even has a more compounded effect. So yeah, so that's basically the effect that it has on mental health. And again, it does change the way your mind fires. First, they're not exactly sure how it works, but somehow the neuroplasticity of the mind is actually altered when, again, consecutive. That's one of the key components here is consecutive. It's not like one. It's not like one session in the gym is going to improve your mental health, right? But it's over time, consecutive. Then heart health, yeah, it's building a stronger heart health. When we were talking about the VO2 max, all that stuff, has a it lowers blood pressure, it lowers resting heart rate, increases VO2 max. So all that stuff has a profound effect on like things like heart attacks.
Yeah, thank you very much, doctor. Thank you.
Hours of sitting per day is vital. That's good. So there's a question that said how many hours sitting hours is advisable. So this test, let me remove this so I can see. So this is the study. This was actually looking at cardiorespiratory systems too. So the light bars were greater than 7 hours, 5 to 7 hours, less than 4 hours. So ideally less than 4 hours would be kind of your best bet. Over 7 hours is kind of like the maximum range. I think most people nowadays probably sit down much longer than 4 hours a day though. Especially with even me, that's one of my problems now is now I'm almost pure writer and I'm sitting down all day. And I have to really be specific. So as you just reminded me, I should have wrote this down. So there does seem to be, they're sitting down, but it seems to be confounded when it's consecutive. So what that means is sitting down for 3 hours compared to sitting down for 3 hours with 5-minute intervals, breaking those up. It does seem like the extended length does have a more profound effect. So this is why we would say, at least if you are like sitting down, some people, they have to sit down their job. It is what it is. So like stand up, walk around every, hour, every 30, 60 minutes, get up and walk around. So does seem to be that excessively consecutive sitting that does tend to have a more profound effect. Let's say we see like in gamers and stuff like that. So if you do sit, it is what it is. I would start getting up, I had a client, I'm set a timer, they'll set a little timer. They even have like those walking treadmills now. I don't know if you've seen those, or find like a standing desk, anything like that. But sedentary, it's actually it's disturbing when you start reading the numbers. So I would say sit as little as possible, but I would try to have it at least under 7 hours. Is that gym or
Professor Garett, I think we have one hand. Bala.
Bala.
Yeah.
Right. Thank you very much. My question is, what type of exercise is best for um, people suffering from nerve pains and the like?
From nerve pain?
Nerve
I'm
pains,
not
yeah.
sure. I'm not sure about nerve pain. I wouldn't be able to answer you on that. I think it would kind of depend on what type of nerve pain. I don't think nerve pain is really from what I know, I don't think nerve pain is a result of
If I could
going
add in
pain.
on that, it's a
Yeah.
study I saw many years ago for back pain, like like
Yeah.
sciatica, is that the
Yeah.
best exercise was dance,
Yeah.
like
So it's-
pair dancing.
Yeah, so things like back pain and stuff, not necessarily nerve pain, but the thing is like so one dance, walking is actually really good. Again, that walking as a decreases back pain. Probably don't have too much time to go into it, but even so this time a lot of times some people will hurt their back and say, oh, I don't want to do deadlifts, right? Actually deadlifts, not deadlifts, but those hip hinge movement patterns are actually kind of the best to mitigate that. But again, I think walking has a severe reduction in back pain. Again, it all depends on what type of the pain it is and all that stuff. So I can't really comment too much on that. But if it is back pain, I know like walking and following a progressive proper program that does use a hip hinge or really movement, like you said, movement. I think just general movement, move it or lose it, right?
Okay. All right. Thank you very much.
You're welcome. Gym or normal exercises? That's a good question. I don't. Listen, you don't have to go to the gym, right? I like the gym, but some people don't like the gym. I get that. It doesn't need to be a gym. Really, anything really. Obviously, you don't want to go to the gym. You could do pull-ups and push-ups and all that fun stuff. Like I said, I do a lot of strongman stuff, like flipping tires and pushing carts and stuff like that. Anything that challenges the body, right? There's nothing. Probably in a whole other conversation, but I said like there's nothing special about the gym, right? The gym, your body doesn't know it's in the gym, right? The gym is an artificial environment, right? So if you're in America, we have like farm strength. So if you're on a farm and you're carrying hay, or you're a UPS driver and you're dealing like wash machines, all that stuff, like that counts, right? So as long as you're putting your body under this stress and your body's adapting, it doesn't have to be the gym.
Garrett, I have to leave right now and go off to another meeting. So I'm going to leave you in the hands of Dr. Canbiro, which you might see him on the screen.
Well,
So he will now take over, and I'm going to make him host, and he will take over the meeting. Wonderful, wonderful work. Wonderful presentation. I want you to come back. We want you to come back and keep this topic going. And I know you have a lot of things you can talk about, but blending in this need for exercise and the benefits from it is a topic that we want to keep sort of hammering home.
Right. Yeah, I think it needs to be, like when cigarettes, started declining in America, they started putting pictures of like diseased lungs and stuff. It's like it has to be in your face over and over. And we, as a society, worldwide society, we kind of be conditioned into thinking that's normal to have these diseases, right? And they're highly preventable.
I think about a person who sits there like in bed or sitting down looking at their phone, and then they spend maybe, like kids nowadays are spending 7 hours on average on their phones.
Yeah.
And if they just got their phone out and walked or got on a treadmill or just did some dancing while on their phone, just do something, but don't let the body just sit there, right?
Yeah. Like I think the issue is because it's accepted. It's like a side note, right? People say, "Oh, make sure to exercise," but no one says anything about it. So, and I don't want to talk about like you have to be careful because we say like look what we do with COVID, right? and I'm not saying we need to do this, right? But like, the entire world was shut down and businesses are shut down and people were thrown in jail. And obviously I'm not saying we need to do that with this, but it needs to be taken a lot more serious than it is now. Now it's just like a little friendly little footnote. And that's not going to change society. That's not going to change society's view on it. But like you said, it has to be constant repetition. And again, education, learning these things. No, this actually does have a profound effect on my health, right?
Okay, thank you, Professor Lambert, the representative, Professor Garett R. Appreciate you. We have one hand, Blair. We will ask him to unmute. Hello. Hello, Blair. Unmute
Yes.
your audio and ask your question, please.
Okay, thank you very much, Prof. Can you hear me?
Yes.
Yes, can hear you.
Yeah, Prof. I think today we've overspent our time or the lecturing time, and this is insightful thing that you're giving it to us. Never knew some sickness, when you get it, it has a lifespan that you live on this earth. And now we've explained everything to us. I love it very much. Thank you very much. Secondly, no, in Africa, and anytime I ask my question, I always consider Africa because I'm African. Doing such exercise, walking by the roadside, jogging or whatever it is, quite dangerous in Africa. I think my colleagues can testify. Yeah, and that I think that's the best thing for us to be doing. That's the way thing for us to be doing to get our body fresh and then get a better exercise. What do you think should be the next thing? Because in Africa, we have a lot of rural areas that you don't have access to the gym and other big recreational grounds. What do you think is the best for us to, or the best place for us to do exercise? Once I just said the roadside is quite dangerous. You could be knocked down by, you could be knocked down by a car or anything, and the person will not be charged with anything. So what do you think we should do? Thank you.
So, yeah, so this goes. So I mean, so one thing on the kind of like the more muscular strength side, obviously you can always do calisthenics, push-ups, pull-ups. Do you know TRX? Have you heard TRX? It's like the two straps. I use that for a lot of people in your position, not necessarily, they don't have time. So put that up in a tree and put that up. You can actually hook it up in a tree. You can do your push-ups, pull-ups, dips, rows, squats, all sorts of stuff just with that TRX. So for the running part, so that if you can't run outside, that's obviously an issue. There are like little on the cheaper side, like different treadmills you can buy. You know, those obviously cost money. If not, so if you can't run for like a very long time, you could just do like high intensity work, say stuff like mountain climbers, burpees, or even like sprints outside. As long as you have like a house, it doesn't need to be long distance. You could do like sprint intervals, stuff like that. So it doesn't need to be like this long, excessive, 5K. Not there's anything bad wrong with that. I like it. I like running 5Ks. If you don't have room, you don't need a ton of room. You could just do like little sprints, little interval sprints.
Hello, Dipler. I hope you got an answer for your question.
Yes, yes.
The professor, we have one question. Do you satisfied with answer?
Yeah, I'm okay. I'm okay.
Thank you. We have one question in the chat section. Which type of exercise suit best for that are hypertensive patients?
So
Yeah.
generally those types, yeah. So really anything, obviously like anything more cardio may have a better effect on those type of diseases, hypertension. Actually, this man Jeff Young, yeah, we actually had a conversation. It does some diseases need tend to do better with like a specific exercise depending on what it is. So when you're doing things like more like heart cardio type stuff, probably I think it's definitely a good idea to start like the running, the jogging, the cardio, that aspect. But again, they even see decreases with strength training. So again, it's not so much a specific exercise as some do, but it's this whole kind of whole valley, this whole life system that's constantly exercising, training, lifting weights here and there. It's more this like cumulative effect than like a very specific exercise. But some of that time of this, I would definitely say walking at first, build up your cardio, increase your intensity, maybe increase distance wise, and go from there.
Okay, thank you so much for your explanation to questions raised by the students. I appreciate your presentation. You takes a lot of minutes to present it. It's really interesting. Just I wanna appreciate you. I want to know just you to summarize your, because I joined later. It's very interesting. Something how to prevent. It's something related to prevent ourselves from different diseases. I wanna now the summary of idea of your presentation.
A summary?
Just the main idea. Huh?
Okay, so I guess the main idea is, let me think. I like to summarize this quickly. One sentence I would say, so one thing I would say, it is impossible to be healthy living an inactive lifestyle. Just it's impossible. Hoping for doctors to give us a medicine is counterintuitive, because waiting for the doctor to invent something to make us healthy already means we're not healthy. Right? So this, and I think that's really kind of a weird thing to get through, is like the doctors are not going to make you healthy. If you need a doctor to make you healthy, you're not healthy. Right? It's like going to the car mechanic. Like if you bring your car to the mechanic, it's already broken, right? How do you keep your car from going to the mechanic? Oil changes, wash it, all that stuff. So you don't ever go to the mechanic. So that's what we're saying. You will not be healthy living an inactive lifestyle. And so if you want to be healthy, and personally or as a nation, world, this is something that needs to really be taken seriously, or it will get worse, as we saw. It's going to get worse. It's right now, it's what 3 out of 5 people it's going to get worse. I think that's a scary thing. So that'd be my summary. It is impossible to be healthy without physical activity.